Go.
Hi, everyone. Good morning, good afternoon, good evening, depending on your location. Welcome to SOPHIA's latest webinar. We are very pleased to have Lindsay Realmuto with us today. Lindsay's going to talk about her dissertation research at the University of Illinois, in Chicago, I should say. I am Sandra Whitehead. For those of you that don't know me, I am the current president of SOPHIA, and it's been my pleasure to have Lindsay as my colleague for more years than I care to recall. Lindsay and I first met when I first started doing health impact assessments back in the day when I was still at the State Health Department in Florida, and Lindsay was at the Association of State and Territorial Health Officers. And it's been my honor and privilege to work with her and to see her grow into the point where she wants to do her PhD. We started doing HIAs together about the same time. And then Lindsay left us and went to Brooklyn, left us here in DC and went to Brooklyn, right?
There was a stop in San Francisco along the way as well. So yeah.
So she's lived in some of the great cities in our country, and now she's in Chicago pursuing her PhD in public health, and she's going to talk to us a little bit today about her research as it's progressing. I'll take it over, Lindsay.
Great. Thank you so much, Sandra, for that lovely introduction. I think we've known each other for like 15 years at this point. So it is quite a privilege to have known you for that long and been involved with SOPHIA, I think, since its inception, which is super exciting to sort of see how it's evolved over time. So I'm going to go ahead and start sharing my screen. Can everyone, I think it's loading right now. But can everyone just, oh, Mike, if you can give me a little thumbs up. Okay,
that looks great.
All right, so the working title for my dissertation research right now is Better Health for Whom? Exploring the relationship between pedestrian-oriented zoning reforms and gentrification. I want to make a note that while I'm a PhD candidate at the University of Illinois, Chicago, I'm also employed with the American Medical Association as a senior program manager on their science, medicine, and public health team. And I will do a little disclaimer about that in a second, but just to give you a sense of what I'm hoping to talk about today, let me get rid of this little thing. I'm going to get some research context and I think in some ways be a little autobiographical to sort of discuss how I got to this point. And then I'm going to talk very briefly about some literature that helps inform my study and sort of how I'm conceptualizing my research, and talk a lot about approach and research design, and then share some then I want to really emphasize very preliminary findings and talk about some challenges and limitations that I've discovered as I've gone through this work, and then hopefully leave plenty of time for Q&A at the end. My disclaimer here is that any statements or findings in this presentation are really just they're mine and do not represent any sort of official position of the University of Illinois Chicago or the American Medical Association. And I also just really want to note that this is very much a work in progress, and I think that will come out as I talk through some of these things, and even some of the numbers that I note towards the end in terms of findings and sort of where I'm at. I think I just want to make a disclaimer that they might be subject to change as I move forward. So I just want to make sure everyone's very clear on that. Okay, so in terms of research context, you know, as Sandra mentioned, I've been involved in HIA work for quite some time, and you know, this little graphic comes from the archived health impact projects HIA toolkit, which I thought I always really enjoyed because I loved the way that they actually broke down where HIAs had been done. And just to note that so many of them have really focused on planning and zoning. And I think that's what really piqued my early interest in health impact assessment work as someone who was very interested in how we could use the built environment and planning and zoning in particular to help facilitate better public health and health outcomes. After I graduated from my master's program at George Washington University, I worked for ASTO, the Association of State and Territorial Health Officials, for a bit. But then I moved out to San Francisco, where I got to work at the health department there and their program on health equity and sustainability. And they had, you know, a few years prior wrapped up this really big health impact assessment that I think many of you are probably very familiar with, the Eastern Neighborhoods Community Health Impact Assessment, which was really all about, you know, this big planning initiative that the planning department there had initiated, and the health department essentially stepped in and said, we need to have like this more proactive health focus in this. And that helped, you know, sort of spur their sustainable healthy community development index, which had evolved and is now kind of defunct, but something that I got to work on there. And so sort of very early in my career, I had perhaps one might say a naive view that if we could just do better planning and more health-focused planning, like we, you know, like this is where it's at, and this is where it's really was very informative for me. And when we used to do health impact assessment trainings there, we very much a lot of our participants were from the planning and transportation sector, and you know, I really felt like this is where I wanted to go. Fast forward a few years, I started working at the New York Academy of Medicine. That's based out of, as the name would suggest, New York City. And I got to actually lead my first health impact assessment while I was there, around this East Harlem neighborhood plan. And to just give a very, very quick context and overview of that. This was, the neighborhood plan was initiated really by then Mayor de Blasio's affordable housing plan for New York City, which was aimed at preserving or creating 200,000 affordable housing units throughout New York City. And a big component of that plan and policy was about increased density in select neighborhoods across the city, East Harlem being one of them, with the goal of having a mandatory inclusionary or affordable housing component of that. And the city council member who might still be representing East Harlem at the time, really wanted to make sure that whatever plan and zoning that came out of that initiative was informed by the community in a much more robust way than what had historically been done in New York City. And as the New York Academy of Medicine is actually located in East Harlem, so we were a very integral part as an organization involved in this steering committee that was leading that work. And I thought this would be a really great opportunity for us to do a health impact assessment. And so we were really focused on that in terms of what the health impacts would be of the zoning and affordable housing preservation strategies that were recommended from the steering committee. And I think what really struck me about this whole process, and I think was sort of a big motivating factor for me to pursue my PhD, was that out of all of, hundreds of recommendations that came out of the steering committee, what we heard time and time again at community meetings was that the concern over gentrification and displacement was a huge, like the biggest concern of a lot of community members, particularly low-income community members that had been there for many years, who saw their neighborhood changing already. And to the point where when the plan was being finalized and they had a big community meeting to sort of announce it and talk through the recommendations, a huge community group actually took over the meeting and was protesting it, because even with all the work we'd been doing, there was still this intense concern over gentrification. And so this was around 2015 that we were doing this work. And I was struck at the time at the, not that there wasn't research on gentrification and health. I felt like it was really nascent. And there wasn't as much as I was sort of thinking there would be at the time. And when I started coming to terms with that, that's really what motivated me to want to pursue my PhD and ideally do some more research around this area. That field has grown quite exponentially in the past 5 to 10 years. And so that's really exciting to see. So I thought, not that I wanted to pitch my wagon onto that, but at the time, it was really something that struck me as an area that I wanted to be working in. And so what are we talking about with gentrification? It's a word that gets used and thrown about quite often with very different meanings depending on where you sit in the world. I have adopted the definition that the Urban Displacement Project has put out, which is that this is a process of neighborhood change that includes both economic change in historically disinvested neighborhoods, but also demographic change. And that, the change is really a increase in investment and with new higher income residents moving in. And I really like the Urban Displacement Project's definition because it does really acknowledge racial makeup of residents being part of that change, whereas some other gentrification definitions don't always touch on that. And I think from just where I sit in the world, I think that's an important component to think about. So that's sort of my working definition of gentrification as we move through this. And as many of you may or may not know, gentrification can affect health. As I said, that this is like a growing field of interest, and there's been a lot more research put out about this. And it's kind of almost hard to keep on top of it, actually, how much has come out. I really like this visual that came from Ellen and Kaptanian from a Health Affairs article they published a few years ago. But just to sort of highlight that there are some inhibiting health factors that are affected by gentrification. There are potentially health promoting factors, and then there's sort of these variable impacts, and it really depends. It's very neighborhood specific and context dependent. I'm not going to talk too much about this. I just kind of want to give, high level view of what the potential health impacts are. So that brought me to my PhD program. So I started in 2019. I've been focused mostly on community development, housing affordability, and planning and health, although I've found that I've really had to create that component of my PhD curriculum because it doesn't really exist in a lot of places. But I had the extreme privilege of working with Dr. Jamie Shariki in the School of Public Health at UIC, who, a year into my PhD programs was starting this study that was looking at longitudinal changes in pedestrian-oriented zoning. She had done a huge kind of assessment in 2010 looking at zoning, literally, and when I say looking at zoning, I mean reading through zoning codes and coding for physical activity facilitators within the codes themselves. And she really wanted to examine these longitudinal changes and assessing the relationship to physical activity outcomes. So our 2020 study, which was supported by the Centers for Disease Control and Prevention, was looking at the most populous 200 US counties, and which covers about 55% of the US population. So as I was working through my PhD, I was reading through zoning codes and really thinking about, yes, these, we are zoning or planning for better walkability, but are there any sort of unintended consequences of this? And just to also level set, what are we talking about when I'm using the word pedestrian-oriented zoning? Because it's not something that is necessarily clearly defined in the literature. but the way that we have, or Dr. Shriki has conceptualized it, is really a break from very traditional or Euclidean zoning that prioritizes separation of uses, and one that really prioritizes predictable urban form and design. And so in general, pedestrian-oriented zoning emphasizes mixed uses, compact urban form, higher density, and usually either a transit-oriented development and or a pedestrian-oriented development or environment. So really focusing on sidewalks, pedestrian connectivity. And within our study itself, the way we categorize pedestrian-oriented zoning changes included form-based codes, transit-oriented development districts, traditional neighborhood development, transect-based zoning, pedestrian-oriented districts. So these are places that are actually called out as being pedestrian-oriented within their titles, new urbanist districts, and smart growth districts. So those are sort of you could say those are the cases of what we consider pedestrian-oriented zoning. And these are just some very, like, if you've ever read a form-based code, the visual on the top will be very familiar to you. There's a lot of these sort of like street visuals to sort of describe what the urban form should look like within the district. So that brings me to my dissertation research and sort of what my primary research questions are. I just want to make sure I'm doing okay on time. So I'm really interested in sort of what the adoption and implementation of pedestrian-oriented zoning looks like in practice. And the big question is there a relationship between the adoption of pedestrian-oriented zoning and gentrification? I'm also sort of interested in what direction that relationship might be, not necessarily that zoning impacts gentrification, but does the gentrification of a neighborhood impact the potential adoption of zoning changes, and also how these different strategies in terms of form-based codes versus TOD versus like a new urbanist district, how do those compare in terms of their relationship? And because walkability is such a key component of this and a real major driver in terms of the public health interest in these is, wanting to create more walkable communities, also looking at how that mediates the relationship between zoning reforms and gentrification. And I think, I've been asked this question by my dissertation committee, like, why is this research necessary? Why does it matter? And I think it's really very timely and relevant within both public health and planning fields. The adoption of particularly form-based codes has increased dramatically in the US since the early 2000s. I mean, it kind of really got caught on, especially in Florida and California between like 2000, 2010, but it's really taken off in terms of the geographic distribution of it across the country. And also just few studies have quantitatively assessed gentrification-specific outcomes in relation to zoning changes. And as I mentioned earlier, there's just been like this real increase in research around gentrification and health, and also gentrification impacts from built environment improvements. And I'm going to talk a little bit about just really high level, some literature takeaways from that specific space. Okay, so, and I want to make one more disclaimer or caveat that for those who might have seen me present on my research before, some of these slides are going to look very familiar, and also I will have to probably go back and make sure I'm not missing anything that's come out in the last year or so since I've put these together, because this field is sort of always evolving. But in terms of really looking at gentrification and pedestrian-oriented zoning reforms, there's really been very few quantitative assessments of that. The Form-Based Code Institute, in conjunction with Smart Growth America, put together this wonderful report, Zoned In, that looked at the economic benefits and shared prosperity that in places that had adopted form-based codes. They had 4 kind of cases and looking at 4 controls. They also looked at sociodemographic change over time. And then also Emily Tallon, who's based out of the University of Chicago here, has also sort of looked at the socioeconomic context of form-based codes. And both concluded more or less that gentrification wasn't a concern. But I think in both cases, there's like a lot of room for improvement in terms of study design. The Smart Growth study had very few case study comparisons, like I said, for 4 areas that adopted versus 4 that didn't. And Emily's paper was really very cross-sectional in nature and didn't look over time. And in both cases, like gentrification really wasn't the driving or the primary indicators that they were looking at. So in that case, you know, for all those reasons, I think there's a lot of reason to look at this more closely. The other thing that, you know, I think what's been studied much more broadly is sort of gentrification and transit-oriented development in terms of TOD as an infrastructure intervention, as opposed to TOD zoning. Those things are not mutually exclusive. But for the most part, the research is really focused on TOD as like a point, point in geographic space, and how the neighborhood changes around it as new TOD infrastructure gets put in. And even within that field of study, there's quite a lot of mixed findings. A fairly recent systematic review suggests that transit proximity may contribute to gentrification, but it's highly variable. And there's also these, very different empirical methods used, and they note that no solid conclusions can be drawn. And I think a lot of this really comes down to this defining and measuring gentrification. There is no standard way that people do this across studies, and I think that has plays a large part in the fact that there's very inconclusive findings, even though people have been really looking at this for quite some time. The 2019 review also, was very interesting in that they also looked at potential biases that could have been informing some of the study findings. And so that's actually, if people aren't familiar with that, it's an interesting article to read, to sort of see how they found that those who were more biased towards wanting to find gentrification generally did. Just another interesting note there. Makes things more complicated. And then lastly, the other kind of component of this is the gentrification and green infrastructure literature. For those who are familiar with Chicago, this is the 606 trail, similar to the High Line in New York. This was a project that took an abandoned rail line and made it a multi-use path. It's quite beautiful. It's very popular. And so there's been sort of increasing interest in how green infrastructure, parks, and multi-use trails are impacting gentrification. And again, there's some evidence of an association, but with some mixed results. I think some of the work around the High Line has found some pretty striking findings that support the idea that gentrification is occurring. 606, some work that's come out of DePaul University here is also quite compelling. But again, it's like, parks and multi-use trails, these are very different interventions. And so there's a lot of context specific findings here that require a little bit more digging into. But I think this is all kind of as pedestrian-oriented zoning reforms really try to change the built environment and produce more pedestrian bicycle connectivity. I think there's a lot of caution that we have to take from these studies and from this literature to apply to that space. From a qualitative research perspective, I think there's a little bit more of a consistent story, and this is by no means a full picture of that qualitative research out there, but I think in a lot of qualitative literature there is, from hearing from community members, there is much more of a consistent concern of gentrification across studies, across cities. and real concern over displacement. So this brings me to sort of how I'm conceptualizing my research and how pedestrian-oriented zoning actually could lead to gentrification. And I have two working frameworks right now, and this gets back to one of my research questions in terms of what direction is the relationship going in. So in this framework number one, there's this planning policy intervention, i.e. a zoning change that then helps increase private investment in a specific place, and that's facilitated by development incentives. And then that brings increased public investment or private investment in transportation infrastructure, which then creates new housing development, new commercial development, improved transportation options, and perhaps new and/or improved green infrastructure, which then increases neighborhood desirability and real estate increases. And looking then further down the line, sort of the new sustainability class of residents who are interested in a more walkable, thriving, revitalized community, and then potential physical or cultural displacement. So that's sort of framework number one. Whereas framework number two sort of changes that around to say, as new residents come into an area, they might start asking questions like, well, I really want new commercial spaces. I want to see more walkable communities, and they use their political power that previous residents might not have had to sort of make a claim for regulatory changes that help push that agenda, which then kind of the second half of it looks very similar in terms of what that ends up leading to. So for my research design, I'm taking a mixed methods approach. I'm doing 5 case studies where I'm looking at 5 jurisdictions in the Midwest who have adopted a pedestrian-oriented zoning change within a specific neighborhood or district. And I want to make clear that that's actually my focus entirely are places that have adopted a zoning change for a specific area as opposed to the overall jurisdiction overall. And I'll talk a little bit about why I made that choice. And so within the case studies, I'm looking at document and media, like publicly available documents around the planning decision and any sort of newspaper articles I've been able to publicly find, and then also doing key informant interviews. But then I'm also drawing on this huge amount of data that I've collected through this pattern study that I've been working on through my PhD, to really looking to pulling that and saying, okay, across the US, where have these zoning changes been happening? And doing a much larger quantitative component that's looking at sociodemographic changes over time. Ideally looking at sort of how different types of zoning strategies compare to one another and visualizing trends over time. And then ideally, big fingers crossed here, really seeing and exploring whether there's a causal relationship, or first assessing if there's a relationship, and if there is, if it could potentially be causal, and using multi-level regression models and an advanced difference in difference methods approach, which I think there's, for those who stay on top of that literature, there's been a lot of really great advancements in difference methods over the years. And because through the zoning collection part of this, I have, data available for when zoning changes were adopted, or these zoning reforms were adopted. So really being able to sort of assess differential timing through those methods. And then that last bit is including walkability as a mediator within my analysis. So I'm using 2 components to really think about that. One is the EPA's National Walkability Index, and then also looking at what we found within the zoning codes itself, because we have all, and I'll get a little bit to all the data that we collected with that, but sort of comparing what the EPA walkability index looks like to what we actually found in the zoning data in terms of like facilitators for walkability within the zoning itself. And as I mentioned, my sample includes cases where this has been adopted for a specific district or corridor. And also the other really important part about what determining my sample was where I was able to get GIS zoning data for these localities, because if I couldn't really match up where in the city or the geographic space that this was happening, I couldn't really match it to census data. So that was a huge component of the last year of my life, was getting that zoning data and going through that and trying to match up that to census data. So I'm also looking at this at the census block group level versus the census tract level. That was my initial thought, was to look at this at the census tract level. But I found that when I started looking at how census tracts related to zoning districts, that sometimes census tracts were just really big in comparison to where the zoning district was, or like the amount of space that zoning district took up, which made me think I wanted to go a little bit smaller so that I could be a little bit more refined. In terms of my time frame of analysis, I'm looking at census data from 1980 to 2020, and really only including cases that were adopted in 2000 or after, because I really want to have this full 20 years of pre-adoption to assess pre-trans, which is something that's pretty important for the difference methods that I talked about. And so I've identified what I'm, terming treated, or they've been exposed to zoning code reform at the census block group level. And so those were identified as being wholly or partially within a regulated reform zoning district. All right. So this is the the slide where I really want to do a big caveat that this is sort of what I have so far, and is subject to change. But in terms of total jurisdictions represented in the US, I have 249 in 36 states, and close to 3,000 treated census block groups. And then my controls are around 28,000. And so my control groups are essentially all other census block groups that are within the city, that were sort of touched by city zoning of the same. Sorry, let me say that over again. So in jurisdictions that had a pedestrian-oriented zoning reform, my control group is all other census blocks within that city that were touched by zoning. And from my census data, I'm looking at race, Hispanic ethnicity, foreign-born, means of transportation to work, educational attainment, occupation, persons in poverty, and median household income, and then median rent and house value. So this is all census data that I've been able to get, and that's normalized to 2010 census boundaries. I've also pulled in data for the EPA walkability index. I also have historical redlining data that I'm trying to figure out sort of the best way to incorporate that into my analyses. And then all this data I collected as part of the Papern study. And luckily, Dr. Shariki is also letting me use the 2010 data as well, so that I can have some amount of, especially in terms of like the physical activity or walkability indicators within the zoning itself. I can pull in that data versus 2020. And to give a sense of scope about how much was collected through the UIC studies, the physical activity measures that we looked at within the zoning code covered all of these different measures. The ones with asterisks are ones that we only collected in 2020 versus the 2010. And the housing, and so in 2020, we also collected a bunch of housing related measures. I'm happy to talk a little bit more about that because that's something that I've been working on publishing that data, not quite there yet, but hopefully soon. So just the breadth of data that I have for this is actually quite overwhelming sometimes, but hopefully can be used effectively as I start doing my quantitative analyses. So the last few minutes here of my presentation itself, I'm going to focus more on my case studies because I've been a little bit more successful in making progress on that versus the quantitative analysis. So these are my 5 studies in Cincinnati, Evanston, Madison, St. Louis, and St. Paul. So my inclusion criteria was that as a Midwesterner myself, I wanted to focus on the Midwest. I had grand plans of visiting each of these places and doing walkarounds. Finding that might not be as possible to do. But the Midwest also was not really at the forefront of a lot of form-based code or pedestrian-oriented zoning adoption. They've sort of been a late adopter. And so that kind of also helped inform my focus on that, because I also wanted to make sure I could contact folks who, like, the adoption hasn't occurred that long ago, like in 2000 or 2001. I think Florida and California also, as very early adopters of form-based codes, tend to stand out and be somewhat outliers when you're looking at the rest of the US. Also, a lot of cities in the Midwest have been around a little bit longer, especially bigger cities. So they have this already built urban form that I think is sort of an interesting way to look at how pedestrian-oriented zoning changes are being implemented in those spaces. And yeah, that's all I'm going to say about that. So that brings me to some very, very preliminary findings that these are all takeaways from the case studies that I've done, primarily informed by the interviews that I've been doing. And again, just to give you a sense of how much of a in-progress work this is, I still haven't even finished all the, finalizing the transcriptions from all the interviews I've done. So these are really high-level things that I've taken away as I've taken notes and done these within the last few months. So within these 5 case studies, pedestrian-oriented zoning has been primarily applied along commercial corridors. I thought it was really interesting as folks talked to me about how there's very little interest among communities in applying these types of zoning changes to single-family residential districts, which I think really limits the ability to increase density in places that could probably, there's a lot of room for even small amounts of density increases, or promoting mixed uses in low density areas. But they also talked about how they have been very effective at facilitating new mixed use development that have had a positive impact on walkability, and with a caveat that this is true in at least 4 of the 5 case study locations. And in terms of improved walkability, one thing that I think is interesting is, I think when some folks think about improved walkability, we might think about new sidewalks or new pedestrian connections, better crosswalks or better traffic calming. But for the most part, they talked about changing setback requirements and bringing things closer to the sidewalk, building, changes to the building form itself, and lowering or eliminating parking requirements. The other thing that I have found very interesting when they've discussed challenges in terms of implementing these sorts of zoning reforms is how the transect-based planning model, which really conceptualizes urban form in sort of an ecological way from rural to most dense, is kind of hard to make work in existing urban spaces that really have a very set urban form, and versus thinking about like greenfield or new development and places that haven't, don't have like a century or more history of development. So that's been something that I think I want to flesh out a little bit more as I go through this. But some other key takeaways were about the importance of community buy-in and engagement in developing new zoning codes. Although, again, in one case that led to challenges later in terms of implementation. And I will just say in that case, it was sort of fascinating to hear that the community, while they were working, had very, very specific ideas about what should happen on each lot within the plan itself. And because they were so specific, any new development has really struggled to meet what the requirements of the code were, because some require lots to be combined, and then later on that didn't really work out very well, or wasn't really feasible. So that's been another interesting, very takeaway in terms of how implementation can be challenging. From a gentrification displacement perspective, I think a few of the subject matter experts that I talked to were more likely to acknowledge the occurrence of gentrification versus staff that are working within the jurisdiction itself. Although I will say that everyone is very conscious of it as an issue. And when discussing strategies for reducing displacement, they've really largely focused on how the jurisdiction can ensure affordable housing as new development occurs, and also having an equity-focused planning frame from the beginnings. And there's some, I think, really interesting takeaways from that equity-focused planning component that I really want to explore a little bit more. I realized that looking at my notes that I failed to mention how many interviews I've done so far. So I've done 11 interviews, at least one person from each of the 5 case study locations, but it's ended up being a total of 14 individuals because a few of the interviews included more than one person. So just to give you a sense of that. And so coming back to this last bullet point about reducing displacement, I wanted to do some shameless self-promotion about an article that I published with a few colleagues in 2023 that really gets at this issue around designing healthy communities and focusing on strategies to reduce displacement. And so within this article, we reviewed a number of documents that claim to have anti-displacement strategies, and we created a typology to categorize them. But I will note that, and we note this in the paper too, that while it's been talked about a lot and ways to avoid displacement, there really has not been a great amount of evaluation on any of these as strategies to reduce displacement. Inclusionary housing being one of the most prolific and I think most cited strategies to reduce displacement. Some of that literature in terms of its evaluation in that space is very nascent. So anyway, people should check that out if they haven't done so already. And so lastly, I'm gonna just briefly talk about some of the challenges and limitations I faced in doing this. The lack of geographic alignment is one that I think was the most frustrating for me at first, especially looking at zoning data from across the US. Everyone does zoning differently, calls everything different names, does not align with census boundaries. Nothing aligns. It's very frustrating, and it's a real limitation, and one that I'm hoping, because I'm using such a relatively small geographic census boundary, that I can be as closely aligned to the zoning district itself, but it's still a major limitation that I'm not sure I'm going to solve with my dissertation research for sure. Also, just accessing longitudinal census data at this scale has been quite a challenge. I think there's been some really great work in the past few years to make that data more publicly available. And usually if you're looking at larger geographic scale data, like even at the census tract level, that's becoming more possible. But I had to work with a private company essentially to try to get 1980 data, and not to mention that census questions change over time. And so just really getting into the nitty-gritty of what that actually looks like in practice has been quite a challenge for me. And then getting back to this point of defining and quantifying gentrification, as much as gentrification was a motivator for me to pursue my PhD, I think I've decided that I never want to study gentrification again. In terms of having to quantify it and measure it, because I do find that it's just, and hopefully within my quantitative analyses, I'm going to sort of look at, I'm going to measure one, I'm going to use, or I'm going to construct gentrification in a few different ways to sort of make sure that the findings are consistent. But it's definitely a really big challenge. Just the heterogeneous nature of zoning reforms and how they're implemented is a huge challenge. And the fact that just codes change over time, zoning codes change constantly, not constantly, but frequently, I would say. So while we tried to make sure we were only looking at changes, that happened from before 2020, a code that was adopted in 2009 might have also changed several times over since then. And so, there's a huge limitation, sort of what are we actually capturing? And then not having access to data on development, and I'm not planning on including any sort of variables that really capture whether there's transit infrastructure there. And I know that's a huge limitation, but there's only so much I can do. And my last challenge, kind of getting to that point, is time. On the right is my 5-year-old son, who takes up quite a lot of my time. And just trying to manage being a mom, being in a PhD, and working full time. So with that, I want to acknowledge my committee, the Papern team that was so instrumental in collecting data and informing this research, and the funding that really supported my work when I was collecting this data. And with that, I will take questions.
Thank you so much, Lindsay. That was really, really interesting. I really enjoyed your review of the literature, especially because I don't think that there's been a lot of systematic review looking at this. So thank you for that. And we do have some questions in the chat.
Yes.
Raquel wants to know, what strategies would you recommend to address the lack of geographic alignment?
Yeah, no, it's a really great question. I mean, there are ways, excuse me. I think one decision point that I had along the way was saying, if a census block is like half within a district and half out, should I essentially proportionally split that? And there are good reasons to do that, and then there are not so good reasons to do that. Proportionally splitting sort of assumes that whatever underlying data you have is equally distributed throughout throughout that area. And ultimately, I decided not to do that, one, for my own sanity. And, at some point I had to cut myself off and say, how can I do this in the most effective and efficient way possible? And then the other reason I didn't decide to do that was that these are all lines on a map that are drawn by people that, ultimately, if there's the district ends here, you can still potentially be interfacing with that every single day, right? And that this idea of spillover effects, and there are people who are so much smarter than me that are really doing the sort of geographic spatial analyses. And I in an ideal world, I would be doing more of that as part of this. I think right now, if I'm going to be very candid, my main goal is to get it done. And ideally, wait till after I can defend to say, okay, here's all the things that I didn't do great, and maybe build off of that in the future, and doing more spatial analysis to really look at that. But that is the best strategy that I can think of, especially for this. I think the zoning atlas is also another sort of interesting thing that's happening on the side, and for those that aren't familiar, it's, you know, the lack of available national zoning data is a real challenge in terms of wanting to study the impacts of zoning. And so they're doing an amazing job of trying to make zoning data more publicly available across municipalities. And it would be really nice to have more, you know, publicly available data sets where you can evaluate zoning, and maybe bring some consistency and how that's done. But that's, I hope that's somewhat satisfying right now.
I think that's a huge challenge for a lot of us that want to look at the impacts of zoning policies, right? There's not a uniform data set. Every community has control over it to some extent, you know, especially in states, you know, home rule states, right? And then you have the challenge of preemption in other states. So it can be very ununiform in many ways. Anna, would you like to come off of mute and ask your question, make your comment?
I'm trying to remember what was my question. So when you kind of mentioned this, but in terms of that every city or every location that you're looking at isn't the same, but is the broader economic context being used as an input to kind of evaluate? Because the same zoning code, it could have been the exact same zoning code adopted in place A, could have what could be perceived as an effect entirely because of the economic context of place A versus place B, which is in a different economic context and therefore doesn't have the development pressure that would end up displacing people, even if they had the exact same zoning and otherwise similar resources and characteristics.
Yeah, it's a very good question, Anna. Thank you for asking. Hi, Kat. So I think there's a few ways that I'm trying to capture that. One, in terms of using the control group coming from the same cities where the treated group is, because you know, the sense is that if there are these larger economic pressures for gentrification, then you'll see that across that municipality as opposed to just in that one place. So that's one way I'm hoping to capture that. And then the second being the case studies themselves and really hearing from the key informants and also reading the planning documents about like what's going on within these spaces. And in the case of Cincinnati, it's been really interesting to talk to folks and really get the broader picture of why these communities were chosen, and what are some of these larger planning processes that were going on. And you know, the other kind of very interesting part for me is sort of what does that political context and dynamic look like? So in that sense, yeah, that's why I love mixed methods, because you know, you can kind of get the economic stuff by using the control group, but it's been really interesting to hear directly through the key informants sort of understanding these larger economic pressures or interest in these specific areas for why they were chosen for, or you know, why they were selected as places to do these sort of zoning changes. And thank you, Laura, for your words of encouragement. I appreciate it.
Laura also put a question in the chat. She wants to know, has there been any studies comparing quality of life, health, and well-being of people who stay through gentrification versus those who move out?
Yes and no. And I say that because some of the more recent gentrification and health literature, I mean, I think what's so challenging about that question is knowing who stays and who goes. Like, we just don't have great systems in place to know that. Especially if you're looking at like larger quantitative studies. I think there's, like I said, the qualitative literature, I think, paints a very clear picture. But you know, kind of going back to that visual that I put up earlier, I think there is potential, and some studies that are pointing to there are some protective factors. Like of gentrification, if there's reduced crime, if there's better access to schools or food, and you know, within this whole zoning context, if there's better pedestrian walkability, then these could be great if people stay. But then I think, you know, one of my committee members would be very upset if I didn't say that there's also a social cultural context to whether you still feel like you belong in this neighborhood as demographics change, as the culture of the neighborhood changes. And a lot of his work and his research is really focused on that sort of cultural context of gentrification and how they're sort of like feeling other in the place that you once felt very much as part of a community. And so that's where I feel like that social well-being part is actually really tricky to get at, because what are we looking at? Are we looking at like physical health outcomes, or like a more of a mental health social aspect of well-being? And so that's where it just gets like really, really complicated, and certainly a lot of room for future research for sure. There was a question in here also that, I mean, maybe I'm not reading questions fast enough, but the sort of predicting where displacement will occur. Ted, going back to the urban displacement project, I think has some really interesting methodology, and that they're putting together maps around like risk of gentrification. Like the way that they're quantifying stuff is, I think, also very much in the vein of what you're talking about, of like trying to think proactively about where this could occur and thinking about what can be done to make, you know, to help ensure that displacement doesn't happen. So I would point you to that resource as a starting place.
I would also look at what Tacoma, Washington and Arlington County, Virginia have done in terms of anti-displacement and mapping where displacement might go in terms of their middle housing projects. Tacoma's Home in Tacoma is only in phase 2, so they're still in the planning process, and they're looking at displacement as an indicator, and they're using other kinds of health indicators to sort of see what they can do. They've got their proposed policy to try and abrogate and mitigate some gentrification as they're densifying. But I think in any community, you know, when you're dealing with real people, it's hard, right? And Anna, so Fairfax County, Virginia is also developing displacement index. Do you want to tell us a little bit about that project, Anna? Oh, hi, Jarrett from Tacoma.
Yeah, it's modeled after the one in New York, which I placed a link in the chat. So it's not final yet, it's not public yet, but I was part of a small team kind of giving input on what that would include and what would be relevant for Fairfax versus like just copy pasting what New York is doing. Yeah, also in an effort, especially to preserve affordable housing. So the housing department would be using that as an opportunity to identify properties to potentially purchase or purchase in collaboration with a nonprofit developer so that they could stay affordable and be part of our affordable housing, committed affordable housing in practical perpetuity.
One thing on the affordable housing part, since that came up, that I didn't touch on, but certainly have heard. So sort of thinking about the limitations of adopting pedestrian-oriented zoning form and where increased density is possible, but also thinking about, you know, I feel like I've heard a lot in like the APA journal about missing middle housing, right? So it's just like really thinking about what are these 2 to 3 to 4 unit buildings, that where can we put sort of that slightly more dense, slightly more density. And, you know, St. Paul and Minneapolis, I think have gotten a lot of attention recently around removing a requirement for single family zoning. There's also been a lot of that's come up in the interviews that I've done around like how problematic even accessory dwelling unit policies can be, but really thinking about those as important strategies for improving density within single family residential areas. And so, you know, that this is just like one small component. I think affordable, like inclusionary zoning, again, has a lot of challenges in that, like, you need new development if you're going to have new affordable units, as opposed to thinking about, there are so many other strategies around really trying to support legacy residents and staying in their homes. And I think a big one is like home tax sort of cut off, saying that, like, even if the, you know, if your home value increases by a lot, if you suddenly get these huge tax increases, like, how can we make sure that this isn't kicking you out of your home that you've lived in for 40 years? So again, going back to that paper that I mentioned, a lot of those are categories in there. But yeah, so accessory dwelling units certainly are coming up as one strategy, but again, can be quite scary, as Anna is pointing out to some folks. But
actually,
yeah,
on that note,
yeah.
Lindsay, as a person, not as a scientist or anything, but as a person who lives in a place where that scary monster seems to be a permanent threat, and not feeling like that though, is there a resource for educating our neighbors, you know, an accessible resource that we can use so that they're less opposed to more gosh, the word escapes me, more concentrated development?
I have found that the AARP has some lovely resources around accessory dwelling units. And I feel like as an organization like AARP, you know, like, might not instigate a lot of political backlash, but, you know, I think they're really interested in it from like an older adult housing stability standpoint. And I think that, so they've done some really great work on putting together a resource together about benefits and challenges, that I would definitely, like, that's the thing that comes, because I have just found them really helpful. I mean, the American Planning Association is I feel like putting more stuff out around ADUs too, but I think from a, you know, something that's very politically neutral, that might be one. And really just highlighting that it's like, this can be a source of income for people. It's a source for like multi-generational families to be able to live together, for, you know, like older adults to be able to stay close to their grandchildren. Like, there's all these like really lovely values that you can highlight that I think people might find it harder to be so scared about. But not to say that that will alleviate the fears, because I'm not that naive. But thank you all so much for all of your enthusiastic comments and helping me. It's nice. It's always actually a good opportunity to talk through this, because it reminds me that I've made progress, and I do have some things to share. So I appreciate this opportunity.
Are there other questions or comments folks want to make, or recommendations you have for Lindsay?
Hang in there.
Thank you.
It's hard.
Sandra and Emma, thank you so much for coordinating and asking me to do this. This has been great.
We will definitely have you back once you've defended, and have you share all of your results with us. We're so grateful that you could come, and I'm so proud to be your friend.
Oh,
thank you so much for coming today.
Yeah,
thanks everyone
enjoy
for
your meeting
coming.
in April. I'm so sad I won't be able to make it, but I hope it's great.
If you guys don't know what she's talking about, we have our practitioner workshop in Arlington in April. So please join us. Bye, everyone.
Thank you.
Okay, yeah, I unfortunately have to like jump on another call right after this. Otherwise, I would stay for a little debrief, but I'll talk to you all later.
Thanks, Lindsay.
Yeah, take care. Bye.